So, good evening, everyone, and welcome. We would like to thank you for your participation in our webinar. Today, we will host our first webinar of Nightingale Challenge Series number 2, and the topic is about lifestyle and cancer. I am Constantina Cloconi. I'm Young Cancer Nurse representative of Cyprus, and I'm going to co-chair with Ioanna Tsatsou. Ioanna, the stage is yours.
Oh, sorry, I lost connection. So hello, everyone. Thank you very much for being here. I'm going to introduce the two speakers. So we have here together with us Dr. Lena, who is head of the department at Regional Cancer Center in Stockholm, Gotland in Sweden. She is also EONS past president and EONS Advocacy Working Group chair. She has an outstanding list of publications and research in cancer nurses, and she is also a speaker in many conferences as well as in many EONS activities such as the masterclass. She is also responsible for EONS educational progress projects like the RECAN and the Occupational and Patient Safety. And finally, she has many nominations and awards, with the Robert Tiffany Award being the latest. And then we have Celia de los Rios, who is an advanced nurse practitioner in medical oncology from Spain. She is the co-chair of the EONS Educational Working Group and a young cancer nurse. She works in research and clinical practice with special interest in education patients and nurses to improve clinical practice and patient experience. Thank you very much.
Thank you, Constantina, Ioanna. So if it's okay, I'm gonna start sharing the screen. And we give it a start.
But firstly, everyone could feel free to chat and ask, okay?
Yeah, feel free to make any comments. We will be stopping to chat with you as much as we can. Can you see well? Yeah?
Yes, great.
Yes.
So as Constantina and Ioanna are saying, today we're going to be speaking about lifestyle, cancer, and prevention. And for that, well, we just want to talk about what we're going to be talking about. So the different type of preventions, the prevention strategies that they are, the different lifestyles that can affect cancer, things like screening and vaccination that are very important for cancer prevention as well. And we want to stop and talk about the challenges that we get as nurses and what we can do. So why are we talking about this today? Well, cancer is one of the top causes of morbid mortality around the world. And it's the leading problem of the 21st century. We all know someone who has been affected by cancer. And this is only rising and rising. So from 4.4 million cases that we have in Europe in 2020, we are expecting to have a 21% increase and get to 5.32 million of people affected by cancer just in Europe. And everyone, all of us, can be affected by cancer, but some people are at higher risk than others. And some factors are inherited, and we can do nothing about them to change them. But there are others that we can do something about, like lifestyle and environment that can affect the risk. If you look at the leading cancers in 2020, breast, lung, colorectal, prostate, and stomach, all of them are associated with different lifestyles that we're going to be talking about today. We know that around 50% of the cancers can be prevented by things like weight, medications, the sun exposure, the exercise that we do. So what can we do about it? That's why we're going to talk today about prevention. Cancer prevention can be divided in primary, secondary, and tertiary methods. The aim of the first one, the primary prevention, is to decrease the incidence of cancer. And for that, we are speaking about avoiding the things that can affect our risk of cancer. So for example, smoking cessation. Primary cancer, it's focused on healthy population, on everyone. And it's estimated that the cancer diagnosis could be halved just with primary prevention measures. With secondary prevention, we are looking at people that have more specific risk. So they could be people that have already been identified as higher risk population. This includes the screening, early detection. And the idea with this is to try to detect the cancer as early as possible when the disease is curable, so it can be treated. And the third stage, that is where cancer nurses we are doing and we can do so much, is tertiary prevention. This is applied to individuals that already have cancer, but they are candidates to have either morbidities or they could already have the risk of another cancer. So this is divided in two things, is prevent and control the symptoms to avoid that morbidity, but as well as the primary prevention to avoid those risks, to try to avoid them to have further cancers. And successful prevention is a mix between two things, the individual actions, the things that we can do with one person, and then the population. Because in order to people to speak and to engage in prevention, they actually need to be informed about the evidence.
Hello, everyone. I will talk a little bit about EONS Cancer Prevention Plan that was launched earlier this year. And this is a big take on, probably bigger than anything we have ever done within EONS, because it's activities that we are reaching out both to healthcare professionals, not only nurses, but also to patients and their family, and also to the general public. So we are including all three types of prevention that Celia mentioned, and the whole cancer prevention plan is based on the European Code Against Cancer. That is the 12 recommendations to people to reduce the risk for cancer. It's all in line with the focus in also the recently published Europe's Beating Cancer Plan, and all of EONS 5 working groups are involved in this work. And we really thank the young cancer nurses for choosing this topic for the first webinar for this season, because it's a really good kickoff to our big campaign on cancer prevention. Next slide, please. So the cancer prevention plan is got three main parts. It will be provide education like this one, but also more in-depth education on all 12 of the recommendations that you will have to see will come up later. And we also plan some research, and we're going to plan this big campaign also based on the 12 recommendations that I will talk a little bit more about. And you have a link on the bottom of this slide where you can read more about the EONS Cancer Prevention Plan. Next. So what about the campaign? Well, it will start in May next year with the European Cancer Nursing Day, the May 18th. It's going to be on for 12 months. So 1 month for each of the 12 recommendations in the European Code Against Cancer. We will have online and face-to-face events. We will have both national and international events, and we will collaborate with hopefully most of the national European cancer societies and also other international organizations to reach out to all our target audience. So please ask your organizations to join us in this campaign, because it will be a really interesting piece of work, and also great ways for us to get together and act within this important field. Next, please. So that was the introduction, and now we'll start with the first risk factor for cancer, the first and the most important still. Sometimes we forget that smoking is really a big problem, and it's actually the most important risk factor to get cancer. And it's quite bizarre, because about half of the long-term users of cigarettes are actually being killed by this product, and that is up to 6 million people per year. And also we have to remember that Europe have the highest worldwide prevalence of adult smoking is 28%, and also the highest among females, which is 90%. Having said that, it varies a lot between the countries. We also know that smoking during cancer treatment increases both the risk for severe acute and late toxicity, and that smoking cessation is an important self-management action that we need to address to our patients and their families. Next, please. One of the things that I wanted to highlight here when it comes to smoking is actually Waterpipe, because very often we get questions about this, and people think that it's no risks at all involved in using Waterpipe, and that's so far from the truth. When you smoke Waterpipe, you inhalate toxic substances that being released by the burning tobacco. That's often flavored, so you don't really think about it as tobacco. But Waterpipe smokers, they often smoke less or less often than sort of cigarette smoker, but with a greater intensity. They do deep inhalations and also for long periods of time. You know, the typical situation, you see people sitting outside cafes and they're smoking Waterpipes for long periods of time. So they get exposed for a lot of smoke. And one misconception is often that people think that the toxic compartments of tobacco doesn't come through when you smoke a Waterpipe, but that's not true at all. It does not filter the toxins. So that's important to remember. So Waterpipe is also associated with lung cancer and other respiratory diseases. Next, please. And another question we also get a lot is about e-cigarettes. And here, I mean, we need to be realistic and see that e-cigarettes has the potential to reduce the burden of disease and death because caused by tobacco smoking. So if e-cigarettes is an alternative to smoking cigarettes, it's a better alternative. You have to be clear there. It doesn't involve the burning of tobacco and inhalation of tobacco smoke. So it's expected to have a lower risk of disease and death if you compare it with cigarette smoking. But it's heavily marketed and it's controversial and often uncontrolled products. And we know very little about the long-term effects. And for many also, it's a gateway to tobacco smoking for young people because it's very often, the marketing is very often addressed to young people. So we need to keep that in mind. Next, please. Another important issue is about secondhand or passive smoking, which is also associated with cancer. Actually, non-smokers who are exposed to secondhand smoke at home or at work or both increase their risk of developing lung cancer by 20 to 30%. And looking at the results from a large prospective study, it showed that the reduction of secondhand smoking reduces the risk for all types of smoke-related cancer. And we have to look particularly out for children and young people and protect them from being exposed to smoke. Think about it in the car, for instance, you can have a really high concentration of tobacco smoke if somebody is smoking in the car, or for adults, of course, in workplaces, but also in the home. So both smokers and non-smokers must make sure that we ban smoking within our homes and in our workplaces and also in our cars. And in some of the European countries, smoking at the workplaces is still allowed. And you can also wonder about smoking-free hospitals. Are they really smoke-free? I would say most of them are inside or indoors, but you see staff and patients smoking outside or on balconies, etc. So we need to make sure that the small hospitals are really smoke-free on the inside and out. Next, please. So this is just an illustration of the damage or the effect of smoking. On the left-hand side, you see the effect of smoking. To the very left there, you see the different cancers that are associated with smoking. And on the right-hand side of that picture, you see also the chronic diseases that are associated with smoking. And to the right, you have the risks involved with secondhand smoking, both on children and on adults. So you see it affects the whole system basically. Okay, next slide, please. And that's a bit controversial, but you know, smoking and nursing, the prevalence among nurses varies a lot between countries, but it's in some countries that is really common, even in cancer nursing. And very often the reference we hear is that people need to have a break, that a cigarette allows everyone to take a break. So that's why it's more difficult for some nurses to quit. And there's research also showing that nurses who are smokers are less likely to intervene with smoking patients. And for nurses to quit, they need support from workplaces, both from the management, but also from colleagues, of course. And I really have to recommend this paper, Everyone Needs a Breath of Fresh Air, about workplace impact on nurses smoking. One of the EONS team members, Iveta Nohabova, is one of the authors here. So I really recommend that paper for you if you're interested in this topic. Next slide, please.
It looks like we move on.
Yes.
To the next, but first I kind of throw a question of, does any of you smoke? I'm not expecting people to admit if they smoke, but just to think about the amount of people that you see outside of your hospitals smoking, and how many of them have a uniform, and what image are they giving? And obviously it's very difficult to get change and then go out to smoke, but think about how difficult it is to say to someone the damage that smoking can do if you are in uniform smoking outside, or even your colleague is outside smoking. And it's true that it's a very stressful work, but we do smoke a lot. I'm moving to another one that I'm going to try to mix three of them together, that it's weight, physical activity, and diet. And even if there are three different recommendations, there are things that they have in common. So I'm going to start with the weight and how much we talk about weight. It's kind of a topic that we don't really want to talk about. We don't want to tell people, well, you are a little bit overweight, but over half of the population in the EU is overweight, and more than 15%, so it's around 16.5% of them are obese. And these statistics are coming up. So if you look at the EU stats, you can see that our weight is not coming down, it's actually coming up. And it's, as Lena was saying with tobacco, there are differences in countries, but actually all of us are high. And why is this important? Well, we know that obesity is a risk factor for several diseases. Diabetes, heart disease, even is related to premature death. And it is related to 9 kinds of cancers. So breast cancer, colorectal, endometrium, gallbladder, kidney, you can see them there. And even further, if you have cancer and you are obese, you are more likely to have problems related to the treatments because you are more likely to have that metabolic and endocrine abnormalities. So the relation between weight and cancer, it looks like it's because of those metabolic changes that makes the cell more unstable. And the evidence shows that in general, the more excess weight people have, the higher risk they have of cancer, except of one, that premenopausal breast cancer. Actually, the risk is generally lower if you are a little bit overweight. But still, the recommendation should be that we should try to keep on healthy weight. And the healthy weight is not only about the kilograms, but not only the kilograms, the BMI, but as well the weight, the waist. To measure the waist circumference, that's very important. And probably all of you have studied that on university. So it's not only about your weight, but where your weight is as well. And obviously, weight, physical activity normally are quite related. Do you know what is recommendation of minutes per day from the World Health Organization? And why is this so important? Well, adults in Europe, again, are physically inactive. So we are not doing exercise, we are getting obese. And again, there is a lot of variation between countries. So, and it's not related to sun and how lovely the weather is. I was quite surprised to see that, for example, Italy, Greece, they don't really engage with outside activity, even if they have amazing weather. And actually in Latvia, in Denmark, in the Netherlands, where we kind of think always that it's always raining, they do engage with a lot of outside clinical activity. Their recommendations are 150 minutes a week. So 75 minutes of vigorous physical activity a week. That means that all of us between 3 and 5 days per week should be doing physical activity that affect our heart rate. And again, why? Well, physical activity can help us to have a healthy weight, but as well, it looks like it's protective. So it could be associated not only with the reduced body fat, but it can reduce inflammation, it can help with hormones. So it has a beneficial effect, and it has a proven beneficial effect, for example, in colorectal cancer risk and in breast cancer risk. And actually, it's not only about how active we are, but as well, something that happens lately a lot with mobile phones, the working at home, the pandemia. So another different thing, it's about how much we are inactive. So the sedentary behaviors. So even if you are a very active person, if you spend more than 9 hours a day sitting in a sedentary behavior, you are already increasing some risk of cancers, such as esophageal, lung, liver. So we have to think about not only I take 1 hour a day and be active, but as well, we have to keep moving. We have to get up. And what about our cancer patients? Well, there is a lot about physical activity and cancer. And there is the controversy, the forever controversy of the fatigue and people not engaging in physical activity. But actually, doing exercise can help with that fatigue. It can help with the anxiety. It can help with the quality of life of our cancer patients, and it can reduce their mortality. And this links with the last one, diet. Do you know what actually the Mediterranean diet that we all talk about is? And I'm gonna ask a couple of things for people to tell us. Do you know about the Harvard dish? The recommendations on how to divide your dish and how to eat? And one question that Constantina and Ioanna told us as well. Do you ask who in the household are the ones that cook? Because we can tell someone how they should eat, but if they are not the ones that cook at home, how much can they actually help themselves if they don't cook on the diet that they're having? Should we speak to someone else? So what are the recommendations? The recommendations are to eat a lot of vegetable, a lot of fruit and pulses. All of those help for example, the risk of colorectal cancer. They limit high calorie foods because of several things. One, they are high on sugar, what is not good for cancer. Well, actually cancer likes it. And because they are normally very salty. And the other problem is that high calorie food normally, even if they are in high calorie, we eat a lot of them. That promote obesity and turns in an increased risk of cancer. And when we speak about salty food can really affect our stomach. So there is a very good link, or very bad link, better said, between salt and stomach cancer. And because it makes more vulnerable to Helicobacter pylori. So if we speak about infections afterwards, we will be speaking about some infections and some things that can affect our risk of cancer. So what are other recommendations? To avoid processed meat, to limit, not to necessarily to avoid, limit red meat and food high in salt, and to limit high calorie food. And I want to finish with something good for nurses, that it's coffee can reduce the risk of indeterminate and liver cancer. And it may reduce other cancers too. And actually, we nurses, and I'm not one of them, even if I'm Spanish, we love coffee. So I'm just going to give you something good because we're only speaking about bad things. Coffee can reduce the risk of some cancers. Music to my ears, I can hear. Yeah. And the other thing that I wanted to talk about, that is what I ask you, well, I was in university. Maybe I'm too old, but when I was in university, we were speaking about the pyramid of what we should eat and how we should eat it. Well, these have changed. And now we use the Harvard dish. And it's so easy and much less complicated. It's about looking at your dish and dividing it. Divide that half of it should be vegetables and fruit, a quarter of it should be whole grains, and the other quarter protein, and try to be healthy protein. With the amazing company of Mediterranean oil, olive oil, please. And instead of drinking a Coca-Cola, please drink some water or some coffee.
Okay, and here we go. It's getting even worse. I get to talk about cancer and alcohol. Everybody that knows me know that I also like to drink wine. So we are also human beings and we have our habits, but we should be aware of them, of course. So this is quite controversial, but the evidence today is quite clear that drinking alcohol is associated with at least 8 types of cancer. And it's what we call dose dependent. So the more you drink, the more you're at risk. And actually the recommendation from leading world organizations on prevention is if you want to prevent the risk of cancer as much as you can, you should avoid drinking alcohol as much as possible. Okay, so next slide, please. So this is, we see a lot of professional resistance, as I call it here, about the risk with alcohol and cancer. Many people don't believe in that, and they really don't want to talk to their patients about this. And to be honest, the most evidence we have is to prevent cancer. The risk known during cancer treatment, there is some evidence here, but not really strong. So it's mainly for prevention or reducing the risk for a new secondary cancer that's alcohol related, actually. But it's quite new data with the connection to breast cancer. And what we know is that alcohol increases hormone receptor positive breast cancer, and that alcohol can increase the levels of estrogen and other hormones. And that alcohol also may increase breast cancer risk by damaging DNA. And this is recommendations and statements coming from ASCO, the American Medical Oncologists Organization, and it was released 2017, and it was really highlighted a lot. And they say that the risk of breast cancer goes up another 10% for each additional drink a woman regularly have every day. So saying that you drink a glass of wine a day is not a good solution if you want to reduce the risk for an alcohol-related cancer. Next, please. And another area that's also very problematic is what we call coabuse. It's when we have people that both are smoking and drinking alcohol. And here you really increase the risk for cancer, and both for primary cancer and also for secondary cancers. Actually, 1 out of 3 secondary cancers are associated with smoking and or alcohol. So this is really important. And here we need, of course, extra attention when we meet these patients. And what advice should we really give them? Anyone have any ideas? What should we say to people? Say that it's a head and neck patient or a lung cancer patient that's going to go through chemoradiotherapy, and they both drink and they smoke. What recommendation do we give? Anyone?
Constantina, Ioanna? Any ideas, or anyone that want to write on the chat about it? I can see, Lena, that while we were speaking, there were a lot of comments about tobacco in the hospitals and alcohol.
Yeah. Actually, participants are talking about wine and smoking too, or about coffee. Usually, in my experience, we used to recommend to avoid them, but if there is any chance to have a drink, let's say, it could be a wine, a glass of wine. Sometimes they are not they don't follow actually the recommendations, but we have to recommend something. I would like to ask if any one of us have any clinical practice with exercise groups or something like that at their hospitals, or maybe classes for stop smoking or stop alcohol. If you can let us know if someone of us, of you, have something. We have classes of yoga and clinical exercise.
For patients,
art,
Constantina?
Art therapy, yes, art therapy, and for the staff too, separately for the moment. So we have some classes for us and some classes for them. And they follow. I don't know if there is anywhere in Europe is the same.
So in Greece and in my hospital, we have some volunteers from patient associations that are leading some small group with patients to have smoking cessation sessions and some activities for breast cancer patients with some specific exercise to reduce lymphedema, for example. And nothing exists for healthcare professionals.
Yeah, I think we also have we have actually on the new Karolinska Hospital, there's a gym for patients that involve to try to make them exercise during treatment. So I think it exists in a lot of places, but back to this question, I think the most important advice you can give to people that smokes and drinks alcohol during cancer treatment is to start with the smoking, because that's the absolute biggest risk. So I think that's probably the best advice, and support them there.
And you have to remember as well.
Lena,
Sorry,
yeah?
go.
No, I just want to mention that Lena before wrote that smoking and radiotherapy is not a good combination. So we have to focus on that too.
Yeah.
But just remember that as well, if you have people that are abusing anything, alcohol, weight, or sometimes they are the ones, like we can give them recommendations, but there are a lot of comments about if they say, well, I don't want, this is the only thing that I have in life, I don't want to stop. Well, that's a decision that they have to make by themselves. But sometimes it may be that that person that is smoking and has an alcohol intake, and you speak about those things, they may decide to choose to start with alcohol. They may decide to start by reducing a little bit of their smoking intake. So we have to listen to them as well. We have to see what they are open to do, and just don't ever miss an opportunity. So I think generally we feel less confident speaking about alcohol, that how much do you smoke? But after that, we have to pick up cues on patients when they ask us, what can I do about it? Or how can I reduce on this? And the first thing that we have to do, and as Roisin was making a comment, is learning about how we communicate as well.
Okay.
Well, let's move on.
Yeah.
And the next one, it's about sun. So I spoke about the sunny countries. We have to look at ourselves as well. And actually, why are we speaking about sun? Well, skin cancer, like malignant melanoma or basal cell carcinoma, Europe are winning on this, and we don't want to win on this. It's that the incidence is the highest in Europe than any other countries in the world. So we have to learn and we have to act about this topic. And the recommendations about these topics are about avoiding too much sun, especially for children, use sun protection, and especially do not use sunbeds. And it's true that there are evidence, and people say that a lot, and patients say that a lot, that reducing the time that you're outside and have ultraviolet radiation exposure can result in a vitamin D deficiency. But more and more research is coming up saying that actually it's not that easy. So you actually have to get a little bit red and burn to have more vitamin D. So I would rather have a vitamin supplement than a skin cancer. So please, if you have patients speaking about that, just tell them, please protect yourself. We can check the vitamin D and see if you need any vitamin D supplements. And the incidence of what kind of cancers we get are different. It's depending if they have occupational exposure or if it's intermittent and sunburns. So we have to think about as well where our patients are working. What do they do? So young people, and especially in the teenage age, they are very likely to get sunburns because they are less careful about protecting themselves. So we have to focus on explaining them that they have to protect themselves. But when it comes to people that are working outside, it's much more complicated. So they may have to use long sleeves or hats or caps, or just keep protecting themselves with good sun protection. And about sunbeds, avoid them. Just avoid them. They really hurt the skin. And that ultraviolet radiation is especially bad for carcinogenesis.
Okay, moving on, we also need to look at the occupational risks for cancer. And here we, in our prevention work in EONS, we focus completely on the cancer nurses' occupational risks. And as you know, that's mainly is the exposure of hazardous drugs and radiation at work. And if we look at the next slide, you know that we've done a lot in EONS on safety, and we are still doing it. We want everyone to follow our safety manifesto. That is these 4 recommendations. They both look at occupational safety and patient safety. So it's mainly avoiding direct contact with hazardous drugs when you are planning pregnancy or during pregnancy, or also when you breastfeed, and also always use personal protective equipment. And then always speak up if something is or seems wrong, and also provide your patients and their significant others, and encourage them to provide them with the information, and encourage them to take an active part in their care, so they are involved. That will actually increase the level of safety. And we're doing the safety webinars as well. It's 3 webinars that you have the link here, and you can they have already taken place live, but you can attend them and watch them on YouTube via EONS webpage. And the last webinar on safety will be on December 6th. So the registration will open any day now. So keep an eye out for that. And then we move on to probably the one recommendation that's hardest for you to impact yourself, but that's radiation, and that's to finding out if you're being exposed to radiation from naturally high levels of radon in your home. And if you are, you can take actions to reduce these high radon levels with improve your ventilation, and also with sort of building techniques, etc. This is the 9th recommendation in the European Code Against Cancer. And radon is a natural radioactive gas that occurs on the Earth's crust. And some homes have high concentrations of radon, especially those in areas with more natural uranium in the soil and rocks. And radon's radioactive decay product sticks to particles in the air that you breathe in. And the exposure to radon increase the risk of lung cancer. And here also it's dose dependent, so it depends on for how long time and how much radium. So if you want to read more about that, you have a link here on the page, on the slide as well, what you can do to reduce this risk. Yes.
And then we come to recommendations that are very focused on women and very related to breast cancer. One is breastfeeding and the other one is hormones. So it's known that breastfeeding protects against the risk of cancer. It can be premenopausal and postmenopausal, and it can also be protective on endometrial and ovarian cancer. So actually, the recommendation is for people, if they can, to breastfeed, but it should be something that it's a decision from women as well. And it looks like the longer that you breastfeed, the more that you are protected. So pregnancy, especially in younger age, before 30 or before 35, can be a protective effect. And breastfeeding more than 12 months, it's a very good protective as well. And when we come to hormones, we speak about 2 different hormones: oral contraceptive, that have been classified as cancer-causing agents and can increase the risk of breast cancer and cervical cancer. And that's normally on your younger ages. But then we come to another that is postmenopausal, that is a hormone replacing therapies. And this is a treatment that can reduce symptoms of the menopause and can be very necessary for some women. So it's not about avoiding them, but about informing people that are having either oral contraceptive or hormone replacing therapy so they can know the risks. They can affect things like growth, the fertility, the mood, but they can affect as well the risk of breast cancer.
And then we move on again to infections. Nearly 1 out of 5 cancer in the world are caused by infections. Vaccines are the most effective way to prevent some of these infections. There's mainly 2 vaccines. It's the HPV, the human papillomavirus, which causes cervical, anal, and oral cancers. And most countries have some kind of school programs for HPV vaccination, and also some have catch-up vaccination programs. Actually, we have a very interesting program that's just started in Stockholm, where I work, where you invite women between the age of 21 to 26 to do a self-test on HPV. And if they're positive, you get into the screening program straight away. And if you're negative, you get the HPV vaccine for free. So they should never either get any risk for cervical cancer. And also then you have the hepatitis B that causes liver cancer, and most countries have vaccination programs for newborns to avoid that. Okay, we can move to the next slide. And that's about screening. Screening is a type of secondary prevention for early detection of cancer, and EU recommends screening for bowel, breast, and cervical cancer. And here, high attendance is key, of course. You need to come up to a large majority of people invited for the screening programs to be really effective. And there is a large variation in attendance, and I think we all suffer with lower attendance now during the pandemic, of course, and maybe also post the pandemic. And health literacy plays an important role here, and also availability, the price. Is it easy to book an appointment, easy to change an appointment, etc. And so, even if it's gone down a lot during the COVID pandemic, it's also particularly important now to manage the cancer backlog in the aftermath of the COVID-19 pandemic. So it's a very good recommendation for nurses to always encourage people to attend screening programs. And mammography, I think it's the oldest one that most countries have had a national program for a long time. And the best national mammography programs actually reduces the risk for breast cancer, or the risk for mortality, with 30%. And if everyone who was invited attended, it will be a 45% reduction of mortality, which is incredible, I think. And there's lots of ongoing research with individual risk-based mammography. You know, if you have high density breast tissue, you're more at risk, and it's also more difficult to find a tumor. So that's why there's lots of research going on where you try to test different systems based on risk, rather than sort of the same type of program for everyone. And when it comes to gynecological screening or cervix screening, detection and treating early abnormalities, and if you leave them alone, could lead to cervical cancer. And we know that we reduce the risk with 90% for invasive cervical cancer if you regularly go to your screening programs or you attend your screening visits. And almost all cases of cervical cancer result from a HPV infection. And what we do more and more now is actually test for HPV rather than to do a pap screen. And you can do self-test. We in Stockholm, we moved over completely to self-test at home, so the women are doing it from home. Next. is bowel cancer. That's also aims to detect bowel cancer or predisposing conditions. It actually reduced the mortality with up to 30%. And here you can do a fecal occult blood test or a colonoscopy. And also here, it's very practical because you can do the self-test at home as a fecal test. And that's the sort of the start of the screening program. Next slide, please. There's also more new screening programs coming on. So one of them is lung cancer for high-risk individuals, which is called smokers. And the studies done in the Netherlands show that you reduce the mortality, especially for women. And there's lots of feasibility studies going on. And we also have one in Stockholm where we combine with smoking cessation, of course. So everyone invited also is offered help to quit smoking. And also prostate cancer, more controversial because we know that the PSA test will detect more cases earlier, but also at the same time risk for overdiagnosis and overtreatment. So that's very problematic. But also that recent research include additional diagnostic procedures, and they are very promising. So I think we will see national prostate cancer screening programs as well in the future. Yes.
I'm sorry, I moved it too fast.
Yeah.
So now it's our time to ask, because you are very active on the chat and we are not having time to read you all. But I read that someone that I love a lot, who has recently gone through a mammography. Actually, I think that's a very good example that we are not only nurses, we are patients as well. We are people, and just going through normal people experience and explaining them can be very helpful. So our questions is, what challenges do you have to engage in cancer prevention? We thought instead of doing a normal Q&A, we are just going to make you come here and speak about why are we not engaging in it? Because the evidence tells us that we are not doing enough, that we are not engaging on this.
I believe that the resistance to change is a very important factor. Because all these things, smoking, alcohol, and even coffee, are some things in our daily life that we cannot change. We simply cannot change, not even if a diagnosis like cancer happens. There are very strong structures within a person to change. And then it is very challenging if you get something. If you get cancer, then say, I got cancer, I'm gonna smoke, I'm gonna drink, that's all I have left. So yes, I think it's a big challenge.
And what about the challenge that we feel as professionals? So we thought about, like, sometimes we feel resistance as well to get into that's lifestyle issues. I think the example that you are giving, it's a very complicated conversation with someone who has made a decision. But do we find the moments to speak about prevention? Do we find the moments to speak about all of do we take these opportunities?
I think that we mainly focus on the aftermath of the cancer and not what maybe caused it or what can be done to sustain a good lifestyle and good quality of life. We are focusing only on symptom management. And it depends on the setting, because in the hospital setting, we focus on that. Maybe in another setting, primary healthcare, you're gonna focus on prevention.
And have you seen any prevention initiative in your country that you really like, that you think it's new? Constantina,
No,
you were going to tell me
no.
about your challenges.
Actually, it is not a general system, or is not everywhere, but in our hospital, we're trying to educate our patients. And in this option, we're trying to include also the caregivers. So we grab the chance to educate them to prevent the cancer. So if we have, for example, a molecular testing for the patient, we ask for it for the daughter or for the sister, for example. Or if we have the patient and he's smoking, we let them know, please, his son to stop smoking because his father will do the same too. And we're trying to do a combination the patient and the caregiver together. So we prevent for the caregiver and we teach the patient. It's something like that, but is newborn. It's nothing like years experience, something like that. We're trying.
But you are touching a very, very important and interesting point, that and that's something that we speak a lot with cancer nurses. We cancer nurses not only have patients, we deal with their families. We have so many opportunities there to speak about prevention. So I guess
we
now
don't have time usually.
Yeah. But sometimes it's not only that we don't have the time, it's that we don't feel comfortable or confident having those challenging conversations or that communications. But yeah, we definitely we are short staff. We have unclear responsibilities. We don't really we know what we need to be done by the end of the shift. So the other things become less important, not because they are not important, it's because we don't have the time to do them.
And then there's the importance of a team. You must have a team to support you, multidisciplinary team, I mean, because it is difficult to do that alone.
Yes, for sure. And
what can we do?
We try to list a few things that we can do as nurses. And I mean, we mentioned that already, that cancer risk factors are often impacted by socioeconomic status, age and education. And inequalities in access and resources also, of course, affect vulnerable groups. Elderly, for instance, people with disability, underserved or underrepresented minority groups needs special attention here. For individuals to engage, they need better information on risk factor and evidence-based risk reduction actions. So I'm normally saying it like this: well, if it was me that were treated with cancer, at least I would like to have the information from my team and my nurse, so I could make the right decisions about my lifestyle, because nobody else can do it. So we need to provide our patients and their family with information so they know the risk, and then it's up to them to make the changes, of course. And we know this with the teachable moment. Actually, people that are affected with cancer are more prone to take on advice when it comes to lifestyle than maybe before. And as nurses, we are educated to inform and support our people on health issues, and that includes addressing health literacy. So we really need to make sure that we deliver there from our knowledge. And we are also the largest group of healthcare providers, and nurses interact with people throughout their lifespan more than any other profession. So we have great opportunity to impact health and address these problems. So just by asking about his habits, we actually are doing something. If we're not saying anything about this, people will see that as this is not important. So bringing it up is the most important thing. Not trying to push people to change their lifestyle, because it's really difficult, but you need to bring it up and talk about it and open the door so people feel welcome to talk about it. So traditionally, we have been more involved in secondary and tertiary cancer prevention, mainly working with our patients and their family, but we can also do more when it comes to primary screening. Next, please. So nurses' role in primary cancer prevention could be in public campaigns. We're starting one now in EONS, so you're welcome to join us there. And also in different community work, in primary care, in schools. Nurses are involved with vaccination, for instance, in screening programs. Next slide. And we can have a variety of role also when it comes to HPV vaccinations. Nurses recommending people to take the vaccine actually is associated with higher uptake than from other professional groups, because we are a very trusted profession. So we have to remember that giving recommendations here is really important. And also in schools, as I said before, and when we promote health education and promoting healthy lifestyles, there is research showing that advanced practice nurses or midwife they're the only source of primary health care for women, especially in some deprived areas. So then that really, that connection is really, really important when it comes to lifestyle issues. Next. And nurses' role in screening programs, and usually if you read in the literature, it's described in very general terms. Nurses can be a part of the multi-professional teams, when actually nurses have really essential roles. They do the invitation and the logistics, and there's few things that I've seen in my 40 years in healthcare that's so complicated as screening programs. And nurses are sort of setting up this logistics. And also we are involved in the diagnostic procedures, for instance, mammography, the follow-up to ensure continuity. We give information and support, and nurses also do research and education about cancer screening programs. Next. And nurses' roles in secondary and tertiary prevention, we talked a lot about that, and I don't want to repeat that. You know all of the parts that you are involved as nurses, but I want to come back to one thing that Celia also mentioned about families, because family members or other people close to the patients, they often share the risk factors and lifestyle with the patients. And there is actually research showing that this impact their own participation in screening programs, for instance. So we need to pick up on that and make sure we recommend the patient's families as well to continue to go attend screening programs, for instance, and also our colleagues. Next, please. And finally, I just want to say we also have to be role models. We need to live as we learn. We're not perfect. We can't stop doing everything we like, of course. But we need to think about our own lifestyle and make sure we attend screening when we get the invitation, and also that we take the vaccinations. Because somebody wrote in the chat earlier, I saw that we're not very good at taking care of ourselves, and that's really true. Nurses are famous for poor health by themselves. They're looking after their own health. We tend to look after our patients and everyone else, but not ourselves. So that's something we also can do to be good role models. Okay, I think that was the last slide for me.
So yeah, that's it from us. And we just wanted to finish with that message that Lena was saying, that we can make a difference. And in order to make a difference, first we have to be informed ourselves in order to speak with our patients properly. And we have to inform them as well. So as Lena has said, any loose opportunity to explain something to a patient, it's a loose opportunity for the patient to tell you that they want to do something about it. So hopefully we have managed to tell you that this is important. We have managed as well to engage you on this special and very important topic. And hopefully as well, you will want to engage with us in the prevention campaign. So if you do, please contact either of us, Lena or myself. If you are interested in further education, we will do something in the future. So this is not the end. And well, if you have any further comments or questions, I just leave Constantina and Ioanna to lead the questions as well and the comments.
So I believe that we
No, nothing for me, Joanna.
Okay, I believe that we have covered all the comments. It's important to care for ourselves as well as for the others. And I just have to say that all this should start early from schools and universities in order to have good results in the health of the public. I congratulate both of you for this excellent presentation. And thank you all for being here with us today. Constantina?
Also, please feel free to fill the evaluation form. You will receive it through the email. Please, we would like to know your opinion.
And then at the 18th of October is the second webinar of the EONS Nightingale Challenge. It will be about burnout and building resilience, and it would be great to participate in it, to learn more about it. And thank you very much again.
Thank you, everyone.